I am Leah Wilson, Indiana resident and executive director of Stand for Health Freedom. We are a grassroots organization that represents more than 22,000 voters here within the state of Indiana, and our core values are religious freedom, parental rights, privacy, and informed consent. We are asking you to oppose SB 4 in its current form for two primary reasons. Number one, health decisions need to remain as local as possible if we want positive health outcomes. And that starts with the individual decision maker and with the parent. So when we get to arm's length decisions being made for our local communities, then we stray from the outcomes that we want. A regional public health structure will inevitably water down the strong home rule that we have here in the state of Indiana. I have been meeting with county commissioners over the last several months, and I consistently hear from them that regionalization is a bad word because it will always remove some degree of local control. So one potential solution would be to address the concerns about local control being maintained and a strong home rule being maintained by having an amendment to the bill that makes it explicit that the local Department of Health under the county executives will have the final say in any public health guidance over their jurisdiction and the final say in any programming that is done within their jurisdiction. Second, the bill raises too many questions about data privacy. HIPAA is frequently thought of as a fail-safe, and that will protect our sensitive healthcare information. However, there's a misunderstanding that the P in HIPAA actually stands for portability, not privacy, because it is protecting information as it is sent from a provider to the insurance payer. So since, in fact, HIPAA explicitly excludes public health agencies from the coverage of the law, any and all information that goes from local health departments to the state need to be voluntarily sent, not required, aggregated data only, and de-identified before aggregated. De-identified is not enough without aggregate data because our Attorney General has reported to us that data can be re-identified with 97% certainty. So these two issues merit your attention, and I ask that you work to resolve them through the amendment process. And one final note about the Governor's Public Health Commission's origins is it has been said that this health commission was the result of local needs and concerns being heard from around the state. But my organization has the privilege of working with 28 state directors across the U.S., and we were listening to a Maryland hearing, their first hearing on their Public Health Commission bill, where it was announced that Maryland, Indiana, Massachusetts, Michigan, Oklahoma, Ohio, and Washington are all among the first of states tackling the federal agenda through the use of these public health commissions. So Indiana's Public Health Commission was not purely inspired by Hoosiers reporting local problems. So this bill and the commission that recommended it are part of a larger federal agenda. And so I'm asking you to consider the level of local control that could be watered down. And once it leaves the local control, will it be further farmed out at a greater federal level? Thank you.
Yeah, thank you.